Okay, let's get started. Good afternoon, everyone. I'm Larry Boris, Executive Director of the National Association of Worksite Health Centers. And let me just make sure that our recording is on. It is. Appreciate you, everyone, joining us today. Today's session is on adding allergy services to your worksite health center. And this is being recorded, and the recording and the slides will be available to everyone who participated or who registered and other members of the National Association of Worksite Health Centers. So for those who may not be familiar with us, NAWHC is the nation's only nonprofit organization devoted to helping both the purchasers and the suppliers understand how to develop, expand, and measure on-site, near-site, mobile, and virtual health centers. We have the nation's largest clearinghouse of information and data relating to these topics, and we offer a variety of programs such as Today, benchmarking, education, advocacy services, and the ability to help people compare and understand and expand what they're doing and increase the value of their centers. We have our own annual meeting coming up August 22nd and 24th in Indianapolis. Hope you can all attend that meeting. We have a variety of companies that belong, self-insured employers of all industries, of most sizes. I think our smallest member is about 200. Our largest has people in every zip code in this country. And all of them have a level of interest, either as offering healthcare to a covered population or serving employer interest in that area. So we hope if you're not a member currently, you'll join us. Glad to provide information about that. So with that, I'm going to turn it over to our moderator for the day, Jeff Kessler from Allergy Choice. So Jeff, please introduce the speaker and topic for the day.
Sure. Well, thank you, Larry, and NAWHC, and everyone on the call today for this opportunity to share a perspective on allergic disease, which is many times overlooked by employers and undertreated as well. Again, yeah, my name is Jeff Kessler, and I've focused my career on bringing allergy care to those that need it, and have had the honor of leading Allergy Choices for the past 24 years. You'll see some other folks on the list here. We've got a great panel put together, and those introductions will come a little bit later. Go ahead and advance it, Larry. So why are we here talking with you today? Well, worksite health centers have many competing priorities and many valuable programs to address the health and wellness of their employees. And this list encompasses many of those priorities and programs that we hear from employers. And allergies are embedded in the bolded areas: primary care, acute care, chronic condition management in particular. So many visits for sinus, respiratory, ear infections, asthma exacerbations, along with rashes and many, many other things can be telltale signs of underlying allergic disease and triggering these conditions. So these conditions may never go away. They repeat year after year, year round. There are ways to manage this by taking control of allergic disease and those associated conditions. And we think adding value to worksite clinics that we'll be talking about for the rest of the webinar. That's a path for employees, families, and especially their kids. So go ahead, next slide, please. So what is the impact? Allergic disease is kind of insidious, and many times it's hidden in healthcare spend and included in a growing list of medications that are used for allergy. There's lots of studies over decades estimating the morbidity rate of allergies in the general population to be 10 to 20%. And additional studies are showing that there's major consequences to employees in their productivity and quality of life, even rivaling conditions like diabetes and hypertension. And then you add in the related diseases that are many times triggered by allergies, the asthma, sinusitis, and eczema, just to name a few of those. And that percentage of impact can be quite high. And as we mentioned, in the long term, these have been increasing. We've seen this for the past couple decades. We're seeing more pollens, molds, dust mites, much of that driven by the changes in our climate and environment. Increases are also being tracked due to changes in our food supply, our diet, and a variety of other reasons. So when you add all this up and view this in the long term, unless an allergy sufferer is offered a disease-modifying treatment to control or get rid of their allergies, it can be a perpetual cycle of unplanned infections and medication use, and just generally ongoing suffering. And for kids, it can even mean the progression to other conditions if they're not treated. Unfortunately, none of this is going away. There are ways to address allergic disease for employees and a better quality of life, and that's what we're here to talk about. So, yeah, thank you for the next slide. Abby Stensrud from our organization is going to moderate the panel discussion, and she'll share more about the programs that we've implemented and they've implemented. Abby?
Perfect. Thanks, Jeff. So I'm Abby Stensrud, and I head up our new client implementations, specifically with employer groups that have on-site, near-site, or DPC clinic models. And this next part is going to be a panel discussion on the allergy control program. Next slide, please. So what is an allergy control program? Really, if you think of 3 steps: identify, treat, and track. I will cover these briefly, and then we'll move to the panel questions. So let's start with identifying good candidates for the allergy control program. So we provide many different tools to help providers with identification of patients who could benefit most from therapy. Once a patient's identified, they're going to be allergy tested either through skin testing or blood testing. And then based on that patient's history and physical, as well as those allergy test results, the provider can prescribe disease-modifying sublingual immunotherapy, which brings us to treat. So custom allergy drops are taken by the patient at home daily under the tongue, and over the course of time, the therapy retrains the immune system to no longer react to those allergens. So the ultimate goal for patients who have started therapy is to be able to complete therapy and have the benefit continue. So typically patients experience symptom relief in the first 3 to 6 months of being on therapy. This is a multi-year therapy based upon how severe each patient's allergies are. And that leads us to the last piece, which is tracking. So throughout their therapy timeline, the program includes an easy-to-use, HIPAA-secure patient registry that helps patients stay motivated and on track to complete therapy. So how it works is patients will register online. They're going to complete a baseline survey, and each prescription is a 90-day supply. So every 90 days, the patient will complete a new digital survey. And the surveys and trending data are available to both the patients and the providers. And then progress and impact data in an aggregate form is available to the employer. And you'll see an example shortly, which leads us to our panel. So our panelists are going to introduce themselves. We have 3 questions they're going to answer. And let's start with Katie Halsney.
Good afternoon. My name is Katie Halsney. I am the Vice President of Client and Care Strategy for Neopath Health. We are an on-site or near-site primary care clinic partner to employers. We really like to offer customized solutions in the primary care space. So very happy to be part of the discussion today.
Thanks, Katie. Tony?
Morning, afternoon, everyone. Tony Hines, Senior Consultant with Siegel Consulting. We're a national consulting firm, does employee benefits and actuarial consulting for employers, multi-employer funds, public sector. I work with multi-employer funds across the Midwest. With certain clients, I'll consult on their on-site, near-site clinic strategies. In a prior role, I was with the Pike Trade Services of Minnesota Benefit Funds, where I managed their 4 on-site clinic locations across the Minnesota Metro. So thanks for joining the webinar. Looking forward to a good discussion.
Thanks, Tony. Sarah?
Hello, I'm Sarah Hamus. I am the principal of NBS Advisors. NBS Advisors is a very small firm. I'm a lone ranger, but I have dedicated my practice to working with only those clients who really want to change healthcare. So a lot of the strategies, involve the near site, on site, DPC model. Happy to be here and look forward to the discussion. Allergy Choices has been a great partner for my clients.
Thanks, Sarah. And Pat.
Hi, I'm Pat Blackaller. I'm the executive director of the EHCW Cooperative. Basically, we're a group of employers that are working together for all intents and purposes to try to find value in the healthcare space. And so we work with basically with our groups to try to support them in getting the best value. And so this is one of the solutions, quite honestly, that we've found to be really beneficial to our groups. Not all of our groups, I think, do this or use this, but we're continuing to talk to them about working with allergy choices. So
Perfect. Thanks, Pat. Larry, can you advance the slide? So we'll get to question number 1. So the first question is, what were the primary drivers for your decision to implement an allergy control program? And we'll start with Sarah.
Thanks, Abby. When I first learned about allergy choices and all that it does, for me, it was, practically a no-brainer for my clients. I mean, part of my job as a strategic advisor is to make certain that our clinic partners are, implementing really good programs and providing as much great primary care as they can. I mean, we want to draw people into the clinic. We want to take really good care of them. And that means looking at everything, right? It's not just treating the colds or, the diabetes, the high blood pressure. It's, allergies can be, very impactful, on somebody's lives. Fortunately, I'm not, I don't have allergies and nobody in my family really does. But when I'm around people who do, I mean, it's quite clear they suffer from them. So, just getting a program like Allergy Choices, which is low cost, it's impactful, it's easy, it keeps people at work. All of those were primary drivers for me.
Thanks, Sarah. And Pat, can you share your perspective?
certainly, I guess early on, and actually Sarah was the person that was supporting us initially in the first employer that I worked with. And she continues to work with a lot of our groups. But so Sarah had introduced this idea to me, and I will say initially I was kind of like, oh, okay, yeah, that's maybe it's good, maybe it's not. I didn't really think about it a lot. But then as I looked at it more and talked about it more, I really began to believe that this could genuinely make a difference for our people. And it really came down to that point, in that as an employer, this is a way of us saying we really do care about you. That it's not something we had to do. It's not something that was required per se to provide care in some respects. But like it's already been said, it's something that really can help prevent a lot of other things probably going down the road. And also, again, it's showing you value your people in doing something like this. That's my I guess how I viewed it going in.
Thank you. And Katie?
Yeah, so I think for us, it really comes down to, this is another customized approach that we can use to help manage our patients' chronic conditions. And I think people that are suffering with allergies, it is a very challenging diagnosis to have. You never know when you're going to get a flare up. You never know when you're going to have to miss work. And so for us, it was really about trying something new, trying a new approach. We'd often be, patients would often ask, can we do allergy shots? Is there something that we can do on site to help manage their allergies better, besides just offering symptom relief? And so I think this program really fit that for us, where we can offer a solution. Patients generally have great symptom relief quickly with this, and it's really putting them on a path to treatment of their allergies, not just that symptom relief that ends up being very costly for them. And when they are sick, when they're suffering, or when they have to leave work for allergy shots, it's just a lot of time away from work and their other priorities.
Thanks, Katie. And Tony, can you share your primary drivers?
Yeah, so at the time we implemented, we were really just looking to expand the breadth of services that were available to the participants at the wellness centers. to both drive utilization and engagement at the wellness centers, but perhaps more importantly, provide that one-stop shop care that treats the whole patient and not the siloed approach of treating, one ailment in a vacuum. So, really to enhance the services offered within the walls of the wellness centers, and an allergy control program just really fit right into that.
Great, thank you. Larry, can you advance the slide, please? And we'll move to our next question, which is, what are the benefits you've seen because of implementation? And so let's start with Pat, and you can actually advance the slide again, please.
Okay. So basically, we've seen the results with our groups, and actually I've been talking with our medical assistant in clinic. They're seeing, like she had said, effectively like 95% of our people are really really liking what we're doing and liking the support and liking what's happening. And basically we're seeing patients that are truly happy about the results, changes that are happening in their health. Actually, one of the people on our staff are actually in the program and are seeing dramatic changes in what their ability to deal with environmental situations when they're going out in the environment. So it's been something that they've genuinely believed and genuinely seen the results, and even personally seen the results. And I don't get as much of the feedback directly. Our clinical team does, obviously, but they're just really impressed, honestly, with what's happened by doing this. So
Great. And Katie, I know that we talked about the registry earlier, or I talked about it earlier, but could you share a little bit about the benefits that you've seen? And then Larry, if you can advance the slide, we'll get into the registry aggregate data.
Yes, so when we onboarded this allergy program, it was about end of 2022, I think early 2023, right as the registry was coming into place. And so currently we have 2 of our practices and 2 of our prescribers that are trained in this Allergy Choices program. And we've got 48 patients that are actively engaged with the registry at this time. The median time for them to have been on therapy is about 217 days. And you can see 147 surveys have been completed. So you can see that first bar there is the baseline, and then where they are in terms of follow-up 1, 2, 3, 4. And so every 90 days, as Abby said, it's a 90-day treatment. And then we kind of see them again in the office and check in to see how they're doing. And this registry and the survey really gives us a great opportunity to see how they're doing in terms of their symptom relief, how they're feeling in general on the program, how they're doing in terms of following the program. And so that when we see them in office, then at that 90 days, we can get a really good pulse on how they're doing overall. And Larry, can you advance the slide? Thank you. So you can see here the symptom score changes. So in looking at the data that we've received back from the surveys, you see that 33.33% are having a reduction in symptoms from the baseline to their most recent survey results. So this is great to see that people are really seeing a significant symptom reduction. Next slide, please. And then this is medication usage changes. So this is talking about medications that they may have used previously in order to manage their symptoms. We're seeing that 23% are seeing a reduction in the medications that they need to use. So in our case, in looking at the on-site clinic, many of the medications that they would receive for symptom management would be coming from the clinic. So this is really an overall savings then to our clients, as well as just a huge incentive for patients to continue to utilize this program. Next slide, please. Okay, so quality of life improvement, 51% have noticed a significant improvement in their quality of life, which is obviously what we want to see with our patients, is that they are feeling better on this program, that they're able to enjoy being outdoors, and that they're probably going to stay on this program and complete it because of the significant improvement in their quality of life. So these are just some of the results that we receive back and that we can then share with our clients so that they can see that this program really is making a significant impact.
Thanks, Katie. And Tony, what benefits would you add from your perspective?
Yeah, I would say, is a great benefit to the members, the spouses, and the dependents. I saw it drastically improved access and convenience for allergy treatment for our participants. Participants not having to take time off work. Maybe they were being seen at the clinic for a physical therapy appointment, a regular doctor's visit. It enabled them to be seen for allergy as well in that very same appointment. And Katie hit on it, the improvements in quality of life over time, as measured by those quality of life surveys. Anyone who suffers from allergies knows it can be miserable. So, it's just really cool to start to see those improvements over time and know that the participants were, getting value from the program.
Thanks, Tony. So that brings us to our final question, which is, what advice would you offer to groups considering adding an allergy control program in their benefit suite? And let's begin with Sarah from the benefit advisor perspective.
So when you're thinking about, how to talk about, these programs, especially with brokers, first of all, I think you have to find, the brokers who are really open to looking at things differently. Sometimes traditional healthcare, bogs us down a little bit. So when we, broaden our minds and talk to people that, have either experience doing things like this, or brokers whose clients have on-site clinics, or the DPC model, or the near site, it's easier through there because you've got the people like Katie and her teams that understand this and I really want to provide those kinds of services. And I think there's a challenge there, perhaps, Abby, for you and your team to, figure out how else can you package the program to make it easy for an employer to implement. When I'm talking to employers, all of the things that you mentioned, the quality of life, the keeping people in the workplace, the kids. I work with a lot of school districts. So, of course, kids are a big focus. And I was actually surprised to learn that for one of my school district clients, 16% of their patients are kids, pediatrics. Mm-hmm. And, think about trying to convince a child to go in for a shot weekly or monthly or however necessary it is, as opposed to, just a drop under the tongue 3 times a day. That's a pretty easy sell. There's usually a financial impact involved. And unfortunately, I don't get to use data the way Tony gets to use data. But, occasionally we get lucky. And for one of our clients, we were able to follow a person. And before the allergy program, she was spending in 90 days, the plan was spending almost $800 just for her allergy treatments, nothing, to do with other medications or, maybe underlying issues. And she was spending about $300. So about $1,100 in that 90 days was spent in total on her shots and, office visits, et cetera. And with allergy choices, it was $130. And the employer that I was talking to about adopting the program right there said, let's do it, let's go for it. The on-site clinic providers, I'll let Katie talk, a little bit more about that. It's pretty easy sell. I mean, once they understand the program, and again, their willingness to want to do as much as they can for their patients, it's a pretty easy decision to make.
Great, thanks for your feedback. Tony?
Yeah, I mean, along that same vein, my advice would be to, take a closer look at the costs associated with more common forms of allergy treatments available on the market today. Just ask the question, do these treatments get at the root cause of allergy or do they mostly treat the symptoms? And I think you'll find the latter is more common. Jeff hit on it off the top. The number of conditions that are related to or complicated by allergies is significant. So if you can offer a solution that, gets at the root cause of allergy and improves it over time, will you start to see cost reductions in those other disease states as well, asthma, respiratory, sinusitis, etc.
Mhm. So Pat, from an employer perspective, what advice would you offer?
Well, again, I mean, it's if you're improving the quality of life of your employees, if you're taking care of a problem that likely, if even on just on a sheer functional operational level, if you're taking care of a problem ultimately that leads to your people being more available in your workplace, that's an obvious benefit just from an operational perspective, and what you're doing also is helping your health plan, as it's kind of already been said, is eventually this process stops because you've reached a point where, or at least minimized, because you reached a point where the conditions have been mitigated, and so eventually the costs of even the allergy choice program decreases, and the other things that were being masking a problem are not needed anymore. So benefits the health plan, benefits the employer, and it's just a good thing to do for your people.
Thanks, Pat. And Katie, from the on-site clinic company perspective and the on-site clinic perspective, what advice would you offer?
I think what I would say is that initially when we introduced this program to our clinicians, they were a little bit leery of starting something new. I think in some ways, allergy control can be kind of a scary thing to a primary care provider, but really honestly, the program is very easy to follow. There are great resources. The team that we work with at Allergy Choices is wonderful. And honestly, once they started doing it, to be able to offer the on-site testing, to be able to offer the follow-ups, and to be able to give people a treatment solution, it's a new skill that our clinical team was able to learn. It's another way that they're making a really positive impact on their patients' lives. And I think it's been a win-win all around.
Great, thank you. And Larry, can you move to the next slide, please? So really, when looking at the allergy control program and looking at what's important to your organization, really the panel covered a lot of these things, but helping to improve the employees' quality of life, maximizing their health and productivity, increasing that utilization of the on-site, near-site clinic, and really optimizing those outside referrals and being able to offer a disease modifying option for employees is the goal through the program. So I will turn it back over to Larry now at this point for wrap up and questions.
Great. Thank you very much, panelists. We appreciate it. Now what we'd like to do is go around the table for those who are still on the call and see if you have any questions, comments, or experience you'd like to share. Let me start out with Alex Schreiber Allen. Alex, please, if you have any comments or questions.
No, I'm good. Thank you so much.
Okay. Deanna Hahn, any comments, questions, things you're going to share?
No, I'm good too. Thank you so much. Thanks for the info.
Okay. Annie Henderson, Annie, comments or questions? Okay,
Sorry, I was
go
muted.
ahead. Go ahead, please.
I'm with Allergy Choices, so I'm just
Oh.
participating and listening. Thank you.
Fine. All right, Manhia, your comments or questions? Take yourself off mute if you'd like. Okay, Tony Perky, Tony, comments and questions that you have? All right, well, let me ask the panels a couple of questions that I've got then. What kind of training and or supplies is needed for an on-site or near-site center staff to have to incorporate a program like this?
So I can answer that. So as far as what's needed is determining the testing. So whether it's blood testing, that can be done through whoever the clinic is contracted with, whether it's Quest, LabCorp, or a different lab company. Or the other option is skin testing. And that's something that we really work to customize a panel, a regional panel for the clinic. And then we provide the training. And it's a hands-on training where they can experience, like really be able to perform the skin testing and get comfortable and confident prior to skin testing patients within their worksite health center.
So what level of staff do you need for this?
So typically with the testing, it's done with the MA. They choose how they'd want to do that, but then the provider, it is a prescription. So you need to have the provider that can prescribe the immunotherapy.
Okay. Well, let me ask Katie. Go ahead, Tony.
So with lab services, the clinics I operated, we did labs at the clinics. And so that's just a very easy option to just kind of plug it right into, a workflow that you're already doing. With the skin testing, it was, pretty interesting. It is pretty cool, frankly, to kind of do that skin testing and, get that real-time feedback for what you're most allergic to. I think it just makes it a bit more real for people. And it wasn't terribly onerous for the staff to get trained up on it and get comfortable with it and, help Allergy Choices develop that customized formula for the drop. So, both options are feasible. It just depends on, where the group is at.
Gotcha. Okay. Let me ask Katie, is this a program that the employer needs to contract with and then you deliver it, or do you offer it among your menu of services to an employer?
So we could offer it as part of our menu of services, but generally we would want to get the buy-in from the employer that this is something that they want to offer. We would love to offer it to all of our employees that we see and across all of our sites. What we have done with Allergy Choices is we bill directly. So basically all of the treatment is covered by the employer, and that's why we want to get their buy-in to ensure that this is something that they want to provide to their employees.
So is this a buy-up for the employer? Or is it part of your member per month fee or whatever,
Yeah,
however you contract?
it would be a buy-up, so it would be just something that we would pass through.
Gotcha. That sounds great. All right. Any other questions from people who are on the call, or any other comments from the panelists?
Yeah, I'd like to make one last comment. I don't think we addressed this, but you can't readily find this, out in the real healthcare world. A lot of the allergists and the doctors who treat allergies, haven't bought into the program, probably because it cuts into their revenues. I'm guessing it's part of it. So this is, again, an enhancement through the health plan or the clinics, et cetera, that you can't readily get out there in the mainstream world.
Good. Thanks for sharing that. All right. Well, just to conclude, we have some upcoming programs later this month. There's an on-site employee health clinics forum in Chicago that I'll be chairing and welcoming people there. NAWIC members get a $250 discount for that. And then we have another webinar coming up on July, using data to integrate population health strategies. We have our annual forum, as I mentioned, August 22nd, 23rd in Indy. In October, we'll have obesity management and GLP cost mitigation. And in November, we'll have an interesting perspective on the legislative and election update and analysis. So with that, I want to thank everyone who's on the call, thank the panelists, and thank Allergy Choices for participating in this. For people who want more information on this topic or on the NAWHC, please feel free to contact me. With that, I'll leave everyone to have the rest of their day. Enjoy, stay cool, and stay safe. Thank you, everyone. Have a good day. Bye-bye.